EIDM Training of Trainers workshop was held on 2nd to 6th October 2023 in Machakos, Kenya. Participants were middle-level technical officers from TB-endemic countries. The goal of the training was to strengthen the technical capacity of middle-level policymakers, for instance technical staff, in tuberculosis control programs of low and middle-income countries in accessing, appraising, interpreting, synthesizing, and utilizing research evidence in decision-making. The trainers were trained on foundations of policy making, accessing evidence, appraising evidence, synthesizing evidence, and applying evidence. How does this training help you mainstream gender approaches in your TB programs?
The main highlights in this training has been synthesis of data. Most of the time we don't do programming, gender programming, because we don't have adequate information or synthesized evidence towards what to do on gender programming. So this has been very useful, and I hope that this will inform a lot of planning towards gender programming within our country, but also be able to have very impactful communication within stakeholders, so that they can realize and recognize that gender plays quite a key role to TB programs.
What are the lessons you've learned from other NTB partner countries in this training?
Kenya implemented what they call TB, which is an electronic-based reporting system for patients of TB patients. This started in 2012 and it's a national-wide intervention, and it has improved in terms of reporting and recording of patients with TB. Basically, what TB does is that the patient level data is entered electronically in a tablet, and the coordinators, the zonal coordinators, on a quarterly basis, they go around the facilities to collect the data and do the verification of the data. So TB to me is a very important intervention as far as patient level data is concerned. So it's an intervention that Malawi can also take on and learn from Kenya. Thank you so much.
As a trainer, how are you feeling about the role you are being prepared for?
My goal is not to just train people. My goal is also to make trainers who would help cascade this, because whether you like it or not, you will like this to be done at every level in the country, and not just to be maybe as a kind of a consolidated at the national or the central level. So I will drive to ensure that as much as possible, I kind of hash out a lot more trainers who will join hands and just cause the ripple effects.
What is the role of evidence, especially research evidence, in policy and decision making in your country?
I think it's important to get the best available evidence for us to be able to make policies, to get the best available evidence that inform us and make good policies for our country.
LIGHT aims to support policy and practice in transforming gendered pathways to health for people LIGHT with is a 6-year cross-disciplinary global health research program enhanced funded by UKA, led by LIGHT in collaboration with partners in Kenya and help Malawi, Nigeria, Uganda, and the UK.